More than 30 million men and women spend time in prisons each year. In many countries, AIDS is one of the leading causes of death in prisons, along with tuberculosis. Prisoners are 5 times more likely to be living with HIV than adults in the community.
We are the second in the whole world with the highest adult HIV prevalence of 25 as we speak. And amongst male inmates is now 31.4. Amongst women, it's quite high, 69%, and that is the biggest challenge we have insofar as women are concerned.
Prisoners are members of the society. They come from the society. They will return to it sooner or later. So we have to treat them as members of the society. And that means, of course, that we are not treating them in a substandard way, but treat them with the same treatment options as people outside.
HIV affects prisons in all parts of the world. In sub-Saharan Africa, the HIV rates in prisons reflects the high number of people living with HIV in the general population. In Eastern Europe and Central Asia, where HIV is prevalent among people who use drugs, we also see higher HIV rates in prisons. Poor prison conditions increase the likelihood of infection with HIV, tuberculosis, and hepatitis B and C.
During the time I was in prison, I learned a lot. Prisons are characterized with overcrowding, coming with the other challenges such as sanitary facilities. Condoms are not made available to prisoners. This is because there is a belief this will encourage them to have sex. But then the question is, are they not having sex? Is sex not there? Responding to treatment, it goes with a good diet and so on.
Prisons are overcrowded in the majority of countries. Policymakers should have a close look at who is being held in prison, why they are there, and for how long they are being detained. Many prisoners continue to serve sentences for petty or non-violent offences. Many have also spent years awaiting trial. All of these factors affect the overall health of prisoners, including those with special needs. Other key populations, such as people who use drugs, sex workers, and, in some countries, transgender people and men who have sex with men, tend to be overrepresented among incarcerated populations. Most women in prisons are from socially marginalised groups. They are mostly serving short sentences for non-violent crimes. HIV rates among women in prisons are almost always higher than among men in prisons.
केन्द्रीय कारागारभित्र जुन महिला सुधार गृह छ त्यहाँ आजको दिनमा पनि अब 334 जना चाहिँ महिला कैदी बन्दीहरू हुनुहुन्छ। HIV लगायत रिप्रोडक्टिभ हेल्थको विषयमा पनि UNODCले गरेको काम चाहिँ राम्रो रहेको यहाँ पहिला देखि कारागारमा बसिराख्नुभएका महिला कैदी बन्दीहरूबाट चाहिँ जानकारी प्राप्त हुन आएको छ।
Generally, there is a lack of access to healthcare in prisons. For women prisoners, the situation is even worse. HIV and reproductive healthcare services, including those dedicated to preventing mother-to-child transmission of HIV, are particularly limited in women's prisons.
Há grandes constrangimentos para aquilo que é o setor, para a área de infraestrutura sanitária, para a prestação dos cuidados de saúde para a mulher, porque não temos condições para poder fazer parto dentro do estabelecimento, não temos condições de fazer o seguimento da criança dentro do estabelecimento.
Various alternatives to imprisonment should be considered and used for people who use drugs and for those who commit petty non-violent offences, including minors and women. Enabling criminal justice laws, policies and practices plays a critical role in protecting the human rights of prisoners. It can also put a stop to stigma, discrimination and violence in prisons. As the convening agency within the UNAIDS family for HIV in prisons, The United Nations Office on Drugs and Crime, with its partners, the World Health Organization, the UN Development Programme, the International Labour Organization and UNAIDS, supports national governments and civil society organisations to develop and implement effective HIV policies and comprehensive programmes in prisons.
They come here almost every day to receive their dose, and I'm happy also to report that there's quite some improvement on their health status.
We have some good results from the first clinic, and it's good for advocating expansion. However, we still need to advocate for scan up of the methadone in more than 2 prisons.
We are also talking about the continuum of care, so we are also calling on the government and the cooperating partners so that we don't lose these people who are coming out. We should not allow them to die.